welcome to the ICGRx session on how walking saved 2 million lives. I'm really excited to share David Mayer, the CEO of the Patient Safety Movement Foundation, can be here today, all the way from Arizona in the States. Dave and I have known each other for, I think it's nearly 6 years now, when I was a medical student on my elective and was lucky to gain a place on a patient safety camp Dave started, which has been running for so many years and has been inspiring and empowering not only healthcare students, but professionals, administrators, and the whole ecosystem to really champion patient safety. So without further ado, I'm going to hand over to my colleague, Maarja from the ICGRx team, all the way from Scotland, to introduce the session.
Yep. Well, hello everyone, and thanks for joining us today for the ICGRx afternoon session. And for those of you that don't know, ICGRx stands for International Collaborative Grand Rounds, and we're a non-profit initiative passionate about ensuring learning in healthcare remains open access and free to all. So our global team creates free, open access and live experiences, bringing together experts, healthcare students, professionals, patients and stakeholders to discuss important topics in healthcare and also to share best practices to improve health outcomes. So we hope to welcome you to one of our events soon as the healthcare professionals of tomorrow. And we're also proud collaborators with Health Careers Live and are hoping to bring in the international perspective today. So without further ado, we have a talk from someone who really does understand what it means to be a patient advocate. Patient Safety Movement is an organisation with a bold and necessary vision: zero preventable patient harm and deaths by the year 2030. Patient safety is at the heart of our work as future healthcare professionals. And Patient Safety Movement CEO and US-based medical doctor David Mayer is joining us today to talk about why we need to actively work for patient safety and his experience walking across the USA to raise awareness for the topic. So I'll hand you over now. You're not here to listen to me, but I'll pop back up at the end to take any of your questions.
Well, thank you, Raj, and thank you, Maarja. It's a pleasure to be with you. Good afternoon, and as Raj pointed out, for me it's early good morning. I'm here in Phoenix, Arizona, where we're here having record heat waves, but there's no such thing as global warming, as some people have tried to convince us. I just want to share some thoughts today. Raj asked if I just talk a little bit about patient safety and about leadership. You're young. You're deciding your future careers. Healthcare is an amazing career to go into. I wouldn't have changed anything I did in my decision-making through my career, but I wanted to just share some insights and maybe give you a little bit of my gray hair wisdom, so to speak, as you embark on where you want to go and what you want to do. And especially, I encourage you to be a leader in whatever you choose. We haven't had as many good leaders in healthcare. We're seeing more and more of that, I believe, over the last 10 years, but I'll share a little bit about that. You heard my titles. I volunteer my time as the CEO of the Patient Safety Movement Foundation. And one thing I just wanted to make sure everybody was aware of, and you can see it on my shirt a little bit, Unite for Safe Care. Last year we did an annual event. We did the first of an annual event called Unite for Safe Care. It was aligned with the WHO's Global Patient Safety Day on September 17th. We are doing a second event this year on September 17th, aligned with World Patient Safety Day. And the 3-hour event last year has been seen by more than 125,000 people across the world and had numerous congressional leaders. We had Jeremy Hunt, Michael Durkin from the UK. We had Dr. Tedros as the leader of the World Health Organization, and past President Clinton as some of the celebrities and entertainment talking and raising awareness about patient safety. So I hope you'd consider joining us this year. One of the first questions I always get is why patient safety? Why did I pick that as my career? Well, as Raj pointed out, I'm a physician, an anesthesiologist, or as an anesthetist, as they would say in the UK. And when I was a senior resident, I was involved in a wrong-sided surgery. And you think about how can we do wrong-sided surgeries? People come in and we should know the left from our right. and how to do that correctly. But I brought a gentleman in for what was to be a right-sided hernia repair, inguinal hernia. And I put the gentleman asleep and was doing my things and charting and taking vitals as an anesthesiologist and the surgery resident or registrar and nurse prepped, draped, and made the incision on the left side of the abdomen. The surgical attending came in the room about 2 minutes later, got detained outside the operating room on a question about a patient. And as they walked up to the table, said, I thought this was a right-sided hernia repair. The surgical registrar passed out at the table. That was the impact of making a mistake. We all came to work to heal and to do good that day, and we had all missed and started a left-sided hernia repair. We closed the left side, went to the right side, and did the right-sided repair, but we made that mistake. That gentleman who came to us, trusting us, now had 2 scars on their abdomen. You say, how could that happen? And we didn't truthfully learn from it because a lot of times we hide our mistakes and we don't talk about them because we're embarrassed or we're afraid of litigation or we're afraid of the media finding out. And so we didn't learn, and that case struck with me. It was 35 years ago, and it launched my career. But also as an anesthesiologist, the anesthesia community was one of the first ones to really jump on safety because of a documentary that was done in the United States, a TV documentary, national broadcast, that showed anesthesia was the most unsafe discipline specialty within healthcare. That 1 out of 10,000 people died because of an anesthetic mistake. We were giving the wrong drugs. We put our breathing tube in the esophagus versus the trachea, things that really could be fixed. And we learned. And now, over the course of 20 years, anesthesia became the safest specialty around, coming close to 6 Sigma. So I really found that patient safety domain important. I felt I could really do more to save lives. People don't realize that in the United States right now, the statistics show that we unfortunately harm, or the mortality rates from preventable medical harm are 251,000. There was an article published just a few years ago by Maarja out of Hopkins. So it means every year 250,000 patients in the United States die when they come into the healthcare system from mistakes that we make. And these are good people trying to do well, but unfortunately, you know, as the saying goes, to err is human. I make probably 10, 15 mistakes a day, and things I do around the house or activities, but they don't lead to somebody being harmed. In healthcare, when we have a mistake, it leads to somebody being harmed potentially, or worse, somebody dying. Globally, there are over 2 million deaths, some estimate as high as 4 million deaths from preventable medical harm and mistakes. And so we really felt we had to drive, we had to learn, we had to improve, similar to what aviation has done. They're another high-risk industry, and aviation has learned so much about how to be safe, using checklists, communication tools, using technology in a better way, understanding how to do teamwork in a really level the field type mindset. I left healthcare at one time because as an anesthesiologist, I felt we had a surgeon that was hurting people, not intentionally, but wasn't qualified to do the work that they were doing. And I couldn't get my CEO and I couldn't get my hospital leadership or my department chair to listen to me. And I got so frustrated with feeling like I was part of that harm that I decided to leave clinical practice, and I went to Abbott Labs. And I learned more about quality and safety and leadership than I ever did in healthcare. Nobody bothered to look at me and say, how could I develop you as a leader in healthcare? I had to do all that on my own, but going to Abbott Labs, they were putting me through leadership development programs. And I remember one time I was sitting in a room with about 25 other leaders within Abbott, taking these courses from some of the best business schools in the country and around the world, professors that were brought in to talk to us and help educate us about the importance of leadership and how we could be better leaders. And I looked in the back of the room, and there was the CEO of Abbott Labs, a huge global Fortune 250 company, and the CEO is sitting in the back of the room listening to the speaker. And at the break, I went up to the CEO and I asked him, I said, Dwayne, you know, you're one of the best leaders I've ever seen. You're an amazing leader. Why are you sitting in the back of the room listening to this leadership development talk? And he looked at me and said, Dave, leadership is like anything else. It's like golf, it's like tennis, it's like your own personal profession. You have to continuously learn. You've got to develop your skills. You could always be a better leader. And that's why I sit in this class, because I always find I learn something. And I loved it. Those 4 years I was at Abbott Labs, I learned so much about Six Sigma and lean and continuous quality improvement, things I never learned in healthcare. And it allowed me that when I went back to the clinical world, when they finally realized that surgeon had to be dealt with, and my chair called and said, would you be willing to come back now that we dealt with that problem? I said, yeah, I'll come back now. But I want to come back and I want to create educational programs for students and residents around quality and safety, because nobody trained me when I was young. Nobody taught me how to provide safe care. And that really led on my mission to become the best patient safety leader I could, and trying to save lives, trying to reduce those numbers. As you heard Raj say, our mission is 0 preventable deaths by 2030 and by the end of this decade, and we're working hard to do that. I encourage you as young but future leaders to start learning about leadership. Pick up a book, read about it, learn it, find a coach, find a mentor that could help you and teach you. I've had great mentors through my years. I still have some that I use, because while we have friends and we've got colleagues, sometimes you just need that coach, that mentor, to ask specific questions, to talk openly and honestly about issues and challenges. And one of my best mentors was a Professor Cliff Hughes from Australia. He was the former CEO, president of ISQA, the International Society of Quality in Healthcare, as well as the Clinical Excellence Commission CEO in Australia. And Cliff was a brilliant man. He taught me so much, and I was able to use him. One story that Raj knows, because I share it during our Academy for Emerging Leaders and Patient Safety programs every year, is around the term mindfulness. We all want to be mindful. We know the importance of it. You know, different definitions: to be in the moment, to perceive things going on around you, not to be multitasking and missing things that could potentially be, you know, issues that you need to deal with. Well, in healthcare and in patient safety in particular, we teach you to be mindful. Look for different things that are going on around you that could lead to someone being harmed, either a patient or a caregiver. And Cliff and his beautiful wife Liz were visiting us in Maryland. They worked at MedStar Health, which is based in DC and Maryland, for a number of years. And they were visiting us for a weekend. And we went to the grocery store, to the food store that morning with our wives. They were going to pick out some stuff to make for dinner. And Cliff and I were just sort of following around. And as I walked through the produce section, I see a puddle on the floor right next to some of the different apples, oranges, other fruits that were there. And I saw the puddle, but I was thinking about something else, and I just continued walking. And then I turned around because I sensed Cliff wasn't behind me anymore. And I turned around and I couldn't find Cliff. And I looked and I saw Cliff in the corner talking to what looked like one of the managers of the store. And so I walked up as he's starting to walk back to me, and I said, Cliff, what's going on? He goes, well, I saw the puddle on the floor, and I felt I had to find the manager to let them know so somebody could clean up that puddle so no one gets hurt or slips and trips or falls. And I go, wow. You know, here I am, somebody who's been teaching and leading patient safety for almost 30 years, And Cliff, my sensei, my coach, my mentor, just taught me something. I go, wow. I walked by the puddle, noticing it, and didn't do anything. Cliff saw the puddle and acted on it. So you figure, you know, I'm a smart guy. I learned from that. Later that same afternoon, we're walking through a parking lot after getting a cup of coffee. And as I'm walking through the parking lot between two cars, I noticed that the car on the left, its back right tire, was pretty flat. Not totally flat, but looked like it was about had half the amount of air that it should. And again, I just noticed it and kept walking. And I stop about 20 seconds later, and I sense Cliff isn't behind me anymore. And I look, and he's at the car, and he's got a piece of paper and a pen out. And I walk back. I said, Cliff, what are you doing? And he goes, I saw this flat tire, and I'm writing the driver a note to let this driver know that the back right tire is flat, and I'm going to put it on the windshield under the wiper, so when the driver gets in the car on the other side, he realizes that he's got a flat tire versus trying to drive away and maybe not realize it until he got on a major road and potentially could lose control of the car. And again, I say to myself, wow, I walked by that, and I saw it and didn't act. Cliff saw it and acted. And the story, the learnings that day for me were, we can be mindful, but if we don't act on that mindfulness, if we don't change and we don't alert people about a potential issue, it does nothing. We notice it, but people still get hurt. So we have to act on our mindfulness as we go forth. And then I'll close with, Raj talked about my walk across America. Right at the beginning of the pandemic, late February, I was really frustrated. It was one of those nights where I didn't feel like we were making enough movement in the patient safety improvement process. People were still dying needlessly. There was too much harm that was still going on, and we couldn't get the attention of those we felt we needed to make a difference. And out of that frustration comes the term that Einstein always uses, trying to do the same thing over and over, but expecting a different result is the definition of insanity. And I really felt I was going insane. It was time to stop the presentations, the lectures. It was time to stop the PowerPoint slides. It was time to stop the meetings and do something different. So I decided then, after watching the movie Forrest Gump one night that evening, and seeing him running across the country, I would walk across the United States virtually from San Diego to Jacksonville Beach, Florida, a total of 2,452 miles, and start raising awareness, because I felt that a 67-year-old doctor walking across America to baseball parks that were closed. As you can see, I have a love of baseball and the sport. People would want to, the media would want to be interested in what I was doing. And so I started walking, and I developed a Twitter and Instagram handle, the first time I was ever on social media. And if you want to follow me, because I'm continuing to walk to raise awareness about the third leading cause of death in the country and equally important across the world, my Twitter handle and Instagram handle are walk4, F-O-R, PT safety. So walk for PT patient safety. I've got over 1,000 people now who are walking across the world, in the UK, in Australia, in the Far East, in Mexico, and we're all walking together to continue to raise awareness about preventable medical harm and death. Over the course of the last year, I've done over 100 interviews with TV stations, newspapers, radio stations, podcasts, because while they might have not been interested in patient safety, they were interested in why this crazy doctor in the middle of the summer and heat and everything was walking across the country to baseball parks that were closed during one of the worst years our country and the world has ever seen. Not only the pandemic, but racial injustice and issues, the polarity of the politics in the United States last year. It was just, you know, an amazing trek. But I made it. It took 355 days. I finished February 19th, and I'm continuing to walk every day with others. And together we have walked over 200,000 miles together trying to raise awareness about preventable medical harm. So if you want, walk with us, join me on social media, and I encourage you to be leaders. Find your cause, find your coaches, find your mentors, and enjoy the career. Pick something that really, you want to do, that you're passionate about. So Raj and Maarja, I'll stop there, and glad to take any questions.
So I think that's hopefully me also live now again. Thank you so much for that talk. I think there's a lot of, probably quite a new concept to a lot of people in attendance today. Patient safety as its own, unique issue. So that was a really great introduction to the topic and leadership and why leadership is particularly important. If anyone would like to post questions in the chat, please do. We also have a Slido. In the meantime, I had a question which was, I suppose whilst you were at medical school, you maybe didn't see your career going in this direction. You've gone from sort of medical doctor to the CEO of a global movement, really. So I guess my question would be, what would you say to someone who was maybe offered an unusual opportunity or comes across some unexpected diversion in their work life? Would you have any advice for those people?
Well, yeah, I would. My career is unique from your traditional physician. As I mentioned, I went to Abbott Labs. I went to industry for 4 years, and people asked, what do you know about the business side of healthcare? And I said, I don't know anything about that, but I want to learn. They're not bringing me into Abbott Labs to do marketing or to do financials. They're bringing me in because of my clinical expertise and to help them understand new products and to understand how physicians think and why certain things are important. And those 4 years were the best 4 years I've ever had. I had the experience of working with venture capital, starting my own entrepreneurial startup company, which was very interesting to me. So I guess my point is, follow your passion. Follow what the career opens up for you. Many of my friends stayed clinical. They stayed in the operating room, and they found leadership roles, but they were mostly within the hospital or their society organizations, being a orthopedic surgeon or a hospitalist, whatever it was. There will be opportunities in healthcare that'll present. And for those that do go into medical school, keep your eyes open. Don't jump on something right away. Experience things, talk to different people. That's why I think coaching and mentoring, even at the youngest days when you're in high school and then college and then graduate schools, is so important, because those are people you could really bounce ideas off and get thoughts. So follow your passion. Otherwise, if you're not doing something that you're passionate about, I think it feels like you're punching a clock and you're not happy. So find that passion, and for me, it was trying to help make healthcare safer and working with those that were harmed. Unfortunately, in my career, I've met too many families that lost children or lost spouses or lost siblings or grandparents because of preventable medical harm. And I've said in my presentations, those are plane crashes in those families' lives. They never go back. There's always an empty seat at the Christmas time or Thanksgiving or holidays, whatever it is, birthdays that don't come anymore. And it's enough it just makes you cry when you think about it. And we have to do better. We've got to make sure that families are able to be together in the holidays and they're not being lost preventably, because our systems and processes and with healthcare need to be improved.
Definitely, and thank you for that answer. I don't know if you have any questions of your own, Raj, otherwise I have another one, but go for it if you do.
No, I'll just go for it, Maarja.
Excellent. Well, I guess my next question is probably quite relevant to a lot of the young people here today who are maybe about to start their own study in one of the healthcare professions. But, as you're saying yourself, many mistakes can be caught or averted when people feel empowered to speak up. Just like your friend Cliff at that grocery store. So what would your advice be for people to help empower themselves and others to feel that they're able to speak up both at work and in their own lives?
Yeah, it's a great point. When we work in the patient safety domain, we are trying to, what I call is level the playing field. For too long, doctors have been like anointed kings, so to speak. And look, I'm a physician too. And we think that they can't make a mistake. We think their decision making is always right. It was the same thing that was going on in aviation back in the 70s and 80s. They treated the head pilot, the lead pilot, as if they could never make a mistake. And people were afraid to speak up, even when they saw danger approaching. There's numerous examples. I've spent a lot of my career studying aviation and learning their safety tools and techniques and how they made aviation is the safest it has ever been since the invention of the jet engine. They realized that planes weren't crashing because pilots didn't know how to fly them. They were crashing or having mishaps because pilots didn't know how to lead effectively. They didn't know how to manage teams. And an important point about that you mentioned is the ability for others in that team, the co-pilot, the flight attendants, the mechanics, to speak up and to have a huddle and to say, okay, are we all aligned? What's going to happen? If something happens, feel free to speak up and let me know. We are a team here. And we're trying to do that in healthcare. We're trying to level the field so that a nurse feels comfortable to say, wait a minute, Dr. Mayer, there may be something else going on here, or are we sure this is the right course, without being yelled at, without being intimidated, that Dr. Mayer, myself would say, whoa, let's take a minute. It's called a timeout, and let's think, is this the right thing? And if it is, okay, thank you for, stopping the line, as Toyota Production System says. They stop the line, they reevaluate, and then they move forward. In other industries, we celebrate people who raise their hand, who ask that we reevaluate something before putting a patient at risk. And so, yes, that's a big part of what we try to do when we work with hospitals and health systems across the world, is to communicate better and to form a more effective team.
Brilliant, thank you. And I think, for anyone who is interested in the topic of patient safety, the aviation industry is a really interesting example of safety, and one I'd recommend for people to look into. I think we're just about running out of time, but I do have one more question, and then we'll let everyone get along to the reflections disco. As I said, many of the attendees today will imminently become healthcare students and then subsequently the healthcare professionals of tomorrow. So if you had one piece of advice for them, what would it be?
Well, again, don't choose your career too quickly, your discipline, your specialty. Enjoy it, get as much experience and feedback that you can. And then again, find something that you're passionate about. It'll resonate with you. For some people, it comes sooner than others, but when it comes, just love what you're doing and be the best you can be at it. That's a continual learning process. If you're a leader, continue to learn about leadership. If you're an orthopedic surgeon, be the best you could be. But most importantly in healthcare, remember, the most important person is the patient and their family, and everything, they should be at the center of everything we do in healthcare, and we always need to trust their preference, values, needs, and goals as we work with them to make decisions. That's the right decision for them, maybe not for us.
Brilliant. Thank you so much, Dr. Mayer. And with that, we'll pass back on to the main HCL team in the studio. Yeah. Thanks very much.
Thanks, Maarja, and thanks, Dave, for sharing such a powerful journey. I think the questions Maarja has asked has really hit the nail on the head in terms of how a day like today really brings together not only doctors, but nurses, midwives, allied health professions, which of course are the third largest workforce of the NHS, encompassing 14 professions. And really what you started off so many years ago, bringing together an interprofessional audience to really tackle the challenges that we're facing at the moment, and which obviously aren't going away anytime soon. So learning together in teams, moving together and really addressing that culture. Actually, there's no team with just one profession, but we're all working together around the patient to provide the best care we can. And I think, as you've discussed, making sure that's patient-centred, because I think quite often things can become quite different, can't they? As you've clearly articulated. I was wondering if you could tell us a bit more about how aspiring healthcare students can get involved with patient safety efforts at this age. I know there's been so much great stuff going on regarding World Patient Safety Day, and some of the things that you think would be good for them to get involved at this early stage.
Well, it's a great question, Raj, and the first thing I do is encourage people to go to a couple different websites. Clearly, our Patient Safety Movement Foundation website, which is www.patientsafetymovement.org. There's a number of tools, not only for healthcare professionals, but for patients and family members on how to provide safer care. We have got videos, and we've got different presentations and panel discussions that have been archived, and they can look and find something that they think it would be interesting at this young stage in their career to learn a little about the issues. You heard me talk about my wrong-sided surgery. How can anybody, we know our right hand for our left hand. That's so simple, it seems easy, and yet we made a mistake. So that's a great resource. ISQA, the International Society for Quality in Healthcare, is another global organization. And I'd encourage, young students to go to their website and learn about, infection rates and other hospital-acquired conditions that we're all working across the world to try to resolve and improve. And then finally, the International the Institute for Healthcare Improvement, IHI, is another great tool, and they have what's called the Open School, which is a free platform for young students and learners to learn more about patient safety and quality and care. And you could watch videos of leaders and patients and family members. 3 great resources that I encourage them to look into at this young stage in their career.
Amazing. You've got the 3 top resources there. And I think particularly, at this, for many of the audience, being school and college age, I think having an awareness of these issues from the outset really is setting them up to be great leaders of the future and really putting the patient at the forefront of decision making, but also how we go about moving forwards together. Maarja, I was wondering if you could share a bit more about what's coming on tomorrow in terms of the sessions, and I know that the theme around speaking up is something that we'll be covering tomorrow. So tomorrow is looking at current healthcare students and professionals, and we have some key sessions from the allied health professions around speaking up and making sure that your voice is heard. So I was wondering, Maarja, if you wanted to share any more thoughts on the sessions tomorrow, and then we'll come back to the studio.
Yeah, well, I mean, tomorrow, huge variety of sessions for, aimed at current healthcare students, but I'm sure we'll also have some interest for aspiring students, aimed at medical students and professionals, nurses, allied health professions, as you said. From an ICGRx perspective, we've got a session on leading with purpose in the morning, which is quite relevant to what we've been discussing here today. And in the afternoon, we have a session on tackling long COVID, which is, I think, going to be the topic of discussion over the next few years as we hopefully move away from the acute phases of the COVID pandemic, and lots more in addition to that. But those are the ones I remember off the top of my head.
Amazing. Well, thank you so much, David, for joining us from Arizona, and Maarja from Scotland. It's great to have both of you come and share your journey today and be part of this experience. So thank you so much. And we'll let you enjoy the rest of your morning, Dave, and your evening, Maarja. And of course, please do share any questions online using the hashtag VHCC2021 or in the chat on the platform. Any closing words from both of you?
So just thank you, and you're doing an awesome job, all of you. These programs are so important, and continue the great work.
What Dr. Mayer said. And good luck to everyone who's maybe applying to their course of choice over the next few months or years.
Amazing. Thank you so much.